Patrick has COPD, which stands for chronic obstructive pulmonary disease. Regarding Patrick's case, factors that have contributed to his respiratory systems mainly due to him being a smoker for 40 years. Despite quitting in his early 60s, smoking for 40 years has resulted in persistent cough and tightness in his chest. However, this could have resulted from heart disease. 4,000 different chemicals can be found in cigarettes, thus causing damage to the body. Additionally, Patrick has stated that his legs get swollen from the knees down, causing him to walk slowly. This is mainly due to his weight of 95 kilograms and the fluid buildup in his body. Generally, swelling results in patients who have pulmonary hypertension, as the heart cannot efficiently pump blood through the body and backs up in the veins, causing fluid to leak into the surrounding tissues. As a result of gravity, fluid pools in the lowest part of your body, your feet, ankles, and legs. This then causes the liver and kidneys to lack functioning and remove unwanted fluids. Patrick has had a medical history of myocardial infarction to a branch of his left coronary artery when he was 68 years old. Myocardial infarction causes shortness of breath and fatigue, which Patrick has stated to have. Myocardial infarction is when a coronary artery, which supply blood and oxygen to the heart, are blocked due to atherosclerosis and occlusion of an artery, which then results in injury to the heart muscles. This condition is then related to his high blood pressure of 135 to 85 millimeters of mercury, as it affects the lungs and heart arteries due to the narrowing and hardening of the lung arteries. Hence, the heart tries to pump against this increased pressure, making the heart work faster and harder. In response to the increased heart rate, respiration also increases to deliver enough oxygen to the blood, which then correlates to his high heart rate of 155 beats per minute. Another factor that contributes to his heart rate of 155 beats per minute is Patrick's BMI. Patrick has a BMI of 29.3 and a waist circumference of 104 centimeters. This indicates that he is in the overweight category and is in the high risk range. From being overweight, you will have a higher heart rate according to the National Emergency Medication Association. When exercising, Patrick's heart will beat faster as the heart will experience difficulty pumping blood to meet the needs of the overweight body. COPD is a progressive disease that causes bronchi tubes and air sacs to lose their elasticity and expand, which causes air to become trapped in your lungs when exhaling, making it difficult to breathe. The lungs' ability to absorb oxygen is also reduced, and the transfer of oxygen into the bloodstream is limited as the alveoli and the bronchi are damaged. This disease is mainly developed by people who are smokers or live or work in high pollution areas as pollutants are inhaled. Heart failure is where the heart loses its ability to pump an adequate supply of blood, which then affects all major body functions due to the insufficient blood flow. The left side of the heart receives oxygen-rich blood from the lungs, then to the left atrium. The left ventricle receives this blood and pumps it to the other body parts. Left-sided heart failure occurs when the left ventricle located at the bottom left side of your heart does not efficiently pump oxygen-rich blood to the rest of the body. Instead, the blood is pumped back into your lungs, thus causing shortness of breath and a buildup of fluid, which links to Patrick's symptoms. Left-sided heart failure can also be divided into systolic, where the left ventricle cannot contract normally, or diastolic heart failure, where it cannot relax normally. Left-sided heart failure is most often caused by other diseases such as high blood pressure or coronary artery disease, illustrating that it is not directly related to COPD. However, the two conditions can exacerbate each other. This is as the symptoms of left-sided heart failure is worsened due to the added stress placed on the heart when blood is insufficiently oxygenated due to COPD. On the other hand, as stated before, excess fluid in the lungs from left-sided heart failure can make breathing more difficult for someone with COPD. Despite this, there are also similar symptoms present in both conditions, such as shortness of breath, constant cough, difficulty breathing, and fatigue. Furthermore, another theory proposes that COPD causes inflammation that damages airways and destroys lung tissues. Due to this inflammation, the lining of blood vessels are also inflamed and results in systematic inflammation where blood vessels are narrowed. This causes the left side of the heart to work extra hard to pump blood through these narrowed blood vessels, causing higher blood pressure and over time, the left heart a weak pump. Most people who develop heart failure have left-sided heart failure and has had another heart condition first, such as having a previous heart attack. Patrick has both left-sided heart failure and previously has had a heart attack, so he is now at a higher risk of developing right-sided heart failure. When the left ventricle fails, increased fluid pressure is forced back through the lungs, damaging the heart's right side. With the right-sided loss of pumping power, blood backs up in the veins. Because of this, Patrick has swollen legs from the knees down, and he walks slowly as a result. Patrick also has COPD, which can also increase the risk of developing right-sided heart failure. It can have a direct influence on the right ventricle of the heart. Pulmonary hypertension results when the blood pressure inside the arteries rises. This can be in response to abnormally low oxygen levels in the vessels inside the lungs as a result of COPD. The excess strain from pulmonary hypertension on the right ventricle can result in heart failure. All of Patrick's blood test results are imbalanced, which shows he has a bad diet. His glucose level is higher than the average. This is called hypoglycemia, which is when there is high glucose in your body. This is a characteristic of diabetes as the blood glucose level is too high because the blood doesn't produce the hormone insulin. Thus, as your cells rely on glucose for energy, the body will experience multiple complications with a high glucose level. Glucose is obtained from the foods you consume. Carbohydrates such as fruit, milk, potatoes, bread, and rice are the biggest cause of glucose in a diet. This shows that Patrick does not eat much carbohydrates. Patrick's cholesterol levels are not correctly balanced. LDL, which stands for low density lipoprotein, is a bad cholesterol, as well as triglycerides, which is fats carried in the blood from the food we eat. HDL, which stands for high density lipoprotein, is a good cholesterol. Patrick has too much of the bad cholesterol in his body and too little of the good cholesterol. His LDL cholesterol is high as he may be eating too much saturated fats such as animal meat, butter, milk, and fried foods. His triglycerides are too high as he may be eating too much sugar, honey, and other sweeteners, sodas and other sugary drinks, candy, baked goods, flours, bread, and pastries. His HDL, which is a good cholesterol, is low as he may not be eating enough good fats, such as fatty fish, olives and olive oil, and avocado, which can raise your HDL. The electrolytes in Patrick are all imbalanced. Some of the most common cause of electrolyte imbalance are due to fluid loss, which can stem from situations including a poor diet that is low in essential nutrients from whole foods, a kidney disease or damage, as kidney plays a critical role in regulating chloride in your body. From Patrick's imbalanced blood test results, it seems like he has a kidney problem, which highly affects his electrolytes. Each one of his imbalanced blood test results not only affect the insides of his body, but may also relate to neurological function, as his senses may act up on him. Patrick may have an increased thirst and hunger, blurred vision, fatigue, as well as getting tingling fingers and pins and needles around his body randomly. Having an electrolyte imbalance, which will affect Patrick's neurological functions, include muscle aches, spasms, twitches and weakness, frequent headaches, joint pains, numbness and pain in joints, and dizziness. One additional blood test result would be creatinine. Creatinine is a chemical waste molecule that is generated from muscle metabolism. It is transported through the bloodstream to the kidneys. The kidneys filter out most of the creatinine and dispose of it in the urine. Creatinine levels for Patrick would likely to be abnormally high in his body. Generally, a high creatinine level means that the kidneys aren't working very well, so this shows that Patrick has poor kidney functions. His other blood test results also show a contributing factor to a kidney failure.